My name is Tom Spencer. I'm director of a new company called VOAS, which is an advanced veterinary orthopaedic and surgical centre, which is GP-led, based in Poole, Dorset. 4 years ago, we decided to set up an advanced surgical centre as we felt the market needed something that fitted between general practice and specialist referral. So this centre is run by certificate holders and experienced GPs to fill this gap. The product in discussion today is our new toy, which is our NewTom 7G dual energy CBCT scanner. I've always been interested in cone beam for many years. The reason for this is the high resolution alongside the low dose. The low dose is increasingly important not only for staff safety, but also for our patients. With low dose, it means that the clinical justification to the scan or the threshold for it can be lower. So for example, if we were to do a study of a dog's elbow, we would take at least 3 views, quite often more, because to get a perfect cranial caudal may take 2 or 3 attempts. A CBCT scan of that elbow would use the same dose, but the diagnostic yield would be far greater. Staff training, we had 2 days set aside for apps training with Fuji. We trained 6 members of the team. We could have done that in a morning. It's that easy, and I would say that from a complete novice to being competent to take a scan would take around about 30 minutes training. The image quality is exceptionally good. Resolution is up to 90 microns, which I believe is better than any multi-slice scanner available on the market. We can see very clearly the ossicles, for example, in the middle ear of the dog. We can see the tympanic membrane clearly and all the structures of the inner ear. The one area that I think is astounding is when it deals with metal, if we are x-raying where metalwork is present. And we've got examples where on plain x-ray, we can see absolutely nothing. I have a cat where we orthogonally plated its tibia. We have absolutely no detail on plain x-rays, whereas on CBCT, even on a single energy scan and no metal artifact reduction, we can see almost everything.
I'm Lewis, I'm one of the clinical directors at Spring Corner Vets in Bournemouth. When you come into the room, it's just a bit of a wow factor. Like whenever, like Tom was sort of going through the stuff initially when we were looking at CT overall, it was, you know, what are we going to go for? And, you know, the features of the machine and things obviously, you know, slightly different to the conventional fan beams and things like that. So it's what led us down this pathway, and you know, actually just the aesthetics of the machine, and they're just like, you come into the room, you think that is a nice bit of kit, and it's just really nice to have the opportunity to use that sort of thing in general practice. From a client side of things, it just, these amazing 3D rendered effects and things that you can move in all orientations, and you can explain stuff to clients at the same time. It's just phenomenal. Like, and then when it comes to like the individual detail of things, you know, the fact that you can look at, you know, a tiny little coronoid process in really exquisite detail, and you know, ear disease, you know, we can pull out the ossicles, so the little tiny bones in the ears, and just look at them. The fact that we can actually even see those is just staggering. Temporal bones really hard in the head, you know, usually get a lot of artifacts when you're trying to look at that, and they're just not there. We can just see everything we need to see. It's like, it's a totally different beast, you know, to anything I've ever seen before.